All right. So our first question and topic is, how do you never forget your why? Like the why you went into nursing. Why did we choose this field?
Yeah.
Yeah.
That's something that I was thinking about recently too, because
Mhm.
um, during my senior year, I've told people this before, but I actually withdrew from school. Like I got so burned out,
Mhm.
and I just lost sight of like why I was doing all this.
Mhm.
So yeah, I mean, how do you do that? How do you just never forget that?
I mean, I think it's normal to forget it. Honestly, I mean, it's there's times where you are going to feel burnt out, when you're going to feel tired, where you're going to question if it's for you, and I think that's normal. I mean, we've talked about this briefly before about, whenever something's important to you, it's important to question if it's for you, if this is really for you, if it's meant for you, because if you don't question it, how do you know if that's really what you want to do? And so I think it's normal to feel like, you know, burnt out at times and really question if, is this what I'm supposed to be doing? I know at times I felt that way.
During school, or do you still feel that now that you're working?
Both, during school, there's times where I felt like really tired, really like, is this gonna never end? Am I
Mm-hmm.
always gonna feel that way? And then there's days at work that are difficult or where I'm like, is this really, meant for me?
Mm-hmm.
This is what I'm dealing with. But, I always go home and debrief and I'm like, okay, this is for me. I can't picture myself doing anything else. Just being dramatic, but no. But for reals, there are times where, you do question, is this for me? And I think that's normal with any job. Any job has its rough moments, or school can be difficult.
I think maybe, I mean, I don't know, I'm just kind of thinking right now, but I'm wondering if part of the reason we forget our why, a lot of us go into it because, like, we want to help people, right? Like, I want to be a nurse because
Hmm.
I just love people and I want to help them. But
Hmm.
I wonder, if that reality comes crashing into us really hard when we realize, like, a lot of our patients don't want the help, or, it's really hard to teach them that and to get them to want that. So I don't know if maybe it's that clash of like, we think we can, I mean, and it's a good way to think, but we think we can like change the world one patient at a
Hmm.
time. And unfortunately, I mean, most patients don't. And it's just every now and then you get that one or two that just love you and do listen and do change. I don't know.
Hmm. No, I agree. I think that's something I struggled with when I started off, and I still struggle a little bit with it, but I've gotten better, is when you have those patients that you're just trying to do everything for. You're giving them all the resources. You're working your therapeutic
Mm-hmm.
communication, you're listening to them, and they just don't want anything to do with your advice or care or what you're offering them. And it's almost like we take it personally, like, well, what am
Yeah.
I doing this for? Why do I do this if this person doesn't even care? But I think over time you just kind of get used to like, oh, well, there's people like that.
Yep.
There's always going to be people like that. But then, like you said, you get those people who are just really receptive and who really appreciate your care, who appreciate you, and it just makes you all over again realize like, yep, okay, that's
Mm-hmm.
that's why I'm doing this, because of that, that tingly good feeling inside that you get when you really do help someone or change someone's life.
And it's funny when those patients like really reach out to you. It's like it slaps you in the face, and you're like, "Well, of course I'm doing it. I mean, it's my job. Like, of course I care, And
Yeah.
it's like you don't remember all those bad experiences that made you want to quit. You just remember that one, and it's like, well, yeah, of course I care. Like that's what I do. That's who I am.
Hmm. Exactly. I agree 100%.
Sweet. Anything else?
No, I just, that's a great question that someone brought up.